I have a team that we have formed about 4 years ago that is called the Post-Acute Symptomatic Seizure Investigation and Outcome Network. It is formed by 5 hospitals from Cleveland Clinic, Yale, MGH, Rhode Island, and UNC, my center. And we're trying to collect and understand is data variables and risk factors for these patients to be placed on seizure medication, but also data variables and risk factors for these patients to be continued seizure medication in the long-term outcome. Why is this important? This is important because, as we spoke, acute symptomatic seizures are provoked seizures. And the definition of this is that they have a lower risk for the seizures to recur. So they're not the same as epilepsy. But we understand that it's important for these issues to be controlled in the acute phase especially, so we can improve patient outcomes and decrease mortality, because these complications, acute symptomatic seizure, have been associated with both. Knowing the risk factors associated with acute symptomatic seizures and for medication prescription will allow us to probably identify patients at a higher risk for what we have probably to continue with seizure medications for a little bit longer after the acute phase in order to allow patients to recover, as neurorecovery and neuroplasticity is very important for patients' recovery. But now, this doesn't mean that the patient has to be long life or for several months on seizure medication. In the subacute state and the chronic phase of the patient's recovery, these patients get discharged with multiple medications for hypertension, for hyperlipidemia, for diabetes, and others. And these patients tend to be older than 65 years of age. And we also know that polypharmacy is detrimental for patients because it can have side effects and can impact the patient's recovery. So what is next for us is to investigate what is the most appropriate recommended time of treatment for acute symptomatic seizures in this patient to prevent that unnecessary long-term use of anti-seizure medications in the patients that are not at risk of having a recurrence of unprovoked seizure. When we talk about acute symptomatic seizure, there have been bigger studies that have followed patients up to 10 years. The 10 years incidence of having an unprovoked seizure after acute symptomatic seizure in these studies is about 20 to 25%. So you imagine that there's about 75 to 80% of patients that they don't need a long-term use of seizure medication. So what is next is for us to stratify and to create guidelines in what is appropriate time for seizure medication management in this patient that has suffered acute symptomatic seizure in order to discontinue it when they are going for rehabilitation or after hospital discharge or after rehabilitation to make sure that they are not being on a long-term unnecessary use of an extra medication called anti-seizure medication.